Welcome to HPI, the Healthy Populations Institute at Dalhousie University. Well, we know the COVID-19 pandemic has been challenging for many kids and their families. In fact, feeling distressed during a health crisis is pretty normal. It can help us to be motivated to follow those really important public health guidelines, like washing hands and wearing masks. But we also need to make sure that kids with pre-existing or worsening mental health continue or seek out treatment, even when it might be harder to go to clinics in person. We know that during COVID-19, many children and youth are experiencing higher levels of distress, social isolation, anxiety, and depressive symptoms. Calls and texts to crisis support lines, like Kids Help Phone, were up during the pandemic, but fewer kids were accessing other types of care. That's where virtual care fits in. Let's take a look. In response to the COVID-19 pandemic, many health services moved online to ensure access could be maintained, while ensuring important public health recommendations, like physical distancing. Our researchers are assessing virtual mental health care for children and youth. We are studying how kids and their families are accessing services during the pandemic. We are gaining a better understanding of the mental health needs of children during the pandemic. We are evaluating the barriers to access and seeing what helps families access services during the pandemic. We want to know how effective virtual care is in treating children's mental health issues. Our research will help us to provide better mental health treatment to kids when they need it, to promote health across the lifespan. So, we need to remember that stress and worry are pretty normal, especially when things are unknown or in times of change. But when children's stress or worry is regularly disrupting their lives, then maybe it's time to seek help. Let's make sure that children's mental health is a priority. Let's make sure that all kids and families can access the services and treatments they need when they need them. Let's have kids and their families have a say in how they receive mental health services. The pandemic has been tough. Let's make sure kids have resources to cope. Thanks for hiking by. The HPI.